Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Allopurinol. Its brand name is Zyloprim. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how allopurinol works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe allopurinol. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does allopurinol work? Well, it decreases the production of uric acid by inhibiting the action of xanthine oxidase. This enzyme is responsible for converting hypoxanthine to xanthine and xanthine to uric acid. In terms of indications or reasons we would prescribe this medication to a patient, we often see this medication used to treat gout. We see it used to treat recurrent calcium renal calculus, as well as increased uric acid levels in certain situations. With respect to contraindications or reasons we would not be able to prescribe allopurinol, we wouldn't give it to a patient who had a hypersensitivity to allopurinol or to any other component of the formulation. Also, carriers of the HLA-B5801 allele should not use this medication. So what about dosing with allopurinol? So in the treatment of gout, the initial dose would typically be 100 milligrams orally daily. The dose may be increased by 100 milligrams per day at weekly intervals until a serum uric acid level of 6 milligrams per deciliter or less is achieved. Doses over 300 milligrams should be given in divided doses, and the maximum dose would be 800 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using allopurinol, so I'll go over some of those here now. Less than 1% may experience pruritus or itchiness. Some patients may experience a maculopapular eruption. Drug reaction with eosinophilia and systemic symptoms, also known as DRESS, may occur. This is a skin condition. Up to 3% of patients may experience a rash. SJS or Stevens-Johnson syndrome may happen less than 1% of the time, as well as toxic epidermal necrolysis or TEN. That may also happen less than 1% of the time. Some patients may experience a granulocytosis, aplastic anemia, or a raised eosinophil count. Myelosuppression is a possibility, as well as thrombocytopenia. This may happen less than 1% of the time. Hepato or liver toxicity, a hypersensitivity reaction, as well as renal failure or kidney failure. This may happen less than 1% of the time as well. That's all we're going to talk about today with allopurinol or Zyloprim. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.